Hello, my name is Melanie Baldwin. I will be performing the Suture checkoff video um, due today. So, what we have is our little skin pad here. We've got our needle driver, hemostat, and some scissors. Just on a patient in general, we're noting before we begin to suture at all. Time of the incident, we don't want to be suturing something that's over 12 hours old or a couple days old or anything like that. We want to note the size of the wound, the depth, and if there's any tendon or nerve involvement or like lots of bleeding or anything like that. Like I said, with the not suturing like old wounds, we're also not going to suture ones that are, have that tendon and nerve injury. Ones with signs of infection, anything with like purulent drainage coming out of there. We're not going to suture over an open fracture, a puncture bite, like a puncture wound or animal or human bites. We will also not suture over. Um, Before we get started, we're gonna irrigate our wound out, make sure it's nice and clean before we close it up. That can be done with just like a normal saline or a diluted chlorhexidine solution. We will use a small needle, like 2730, to inject lidocaine around the wound site. Um, we're trying to minimize like the amount of times we stick the patient, so trying to go in to the sides of the wound from one insertion point and try to hit everything. If we do need to go back in using a location that has already been hit with the lidocaine there, um, obviously for the lidocaine we want to double check to make sure they do not have an allergy to that. We want to calculate the max dose, especially in a smaller person. We'll aspirate before we inject just to make sure we are not getting it in a vein. Um, we are pretending that this is an arm, so we're going to be using a nylon monofilament 4O. For this area of the body, you could use like typically a 3O or a 4O. For something like a face, we would use a 5O, and then getting onto like a surface, like a surface of the foot or something like that, that you would need a stronger hold for, you would use something larger like a 2O or a 1O. This suture, the nylon monofilament, is a non-absorbable suture, so it will need to come out about 7 days later. The suture has good tensile strength, less reaction there at the tissue, and less coincidence of infection. This one is most commonly used with a surface closure, which is what we are pretending to sew up today. Um, so we will go ahead and get started. Flip this. Maybe turning the brightness down will help a little. Using this stitch will also help us to evert the edges of the wound so that it heals appropriately. Come grab one side, go in and out the other. looping 3 times on the initial goes this way. 1, 2. Then we'll trim those. The next stitch we'll do over here. Then we will go to the other side of the initial one, sewing up like this. Make sure we don't have any uneven edges when we get to the end, or uneven spacing or gapping. One more there. We'll trim that one up. We'll trim these others because they're a little long and in the way. And then the others will go in between the first stitch and the second and third stitch. Just move that out of the way. All right. We've got one left. We will put that one between the first and the third suture. Using the hemostats to kind of invert the edges. Mm, Last one. Just cleaning up the edges. There. So after we're done suturing, we are going to just clean it off gently with some normal saline. We can put a little dab of bacitracin on there, and cover it up with a non-stick Telfa. After we're all done, we're going to teach them how to clean it every day. They can go ahead and clean that in the shower with just some soap and water, making sure that it's, I would say it's the last thing that you clean in the shower. Once you get out, pat it dry with a clean towel, and then keep it covered if it's draining or anything like that. And make sure that we keep it clean and dry, watching out for signs of infection, redness, any drainage, swelling, increased pain at the site. If we have any of that, we need to come back and see us right away. But other than that, we will come back in 7 days for removal of the sutures.